this live. To be sure I'm audible. Mm, 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 mm. See the light in here. And this will help. This will help. Mm, 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 mm. Hello. Thank you for joining in. You are welcome to this live. Okay, welcome. Let me know if you can hear me. Welcome to this live. Hello. Just confirm that you can hear me. Welcome to this live. To be sure that you can hear me. Okay. And to remove this. Please confirm that you can hear me. I remove this. Okay, welcome to this live. Kindly confirm that you can hear me. Thank you. Thank you for the emoji. I hope I'm, I hope I'm, audible. Please let me know in the chat if I'm audible. Shift this a bit. Let me know where you are joining from. Where are you joining this conversation from? And where is your location? We have an anonymous poll there. You can cast your vote. Kindly respond to the questions. Always working on the video display, working on the audio. Hope we are good to go. Let's see. Reduce this a bit. Please confirm that you can hear me. I know we are in different time zones, and interestingly, it's 18th of May 2025 on this side. I know that in the United States it's still 17th. That's a Saturday. And then the 17th is the day that has been marked out for the celebration of World Hypertension Day. World Hypertension Day. So that's what we are actually talking about. If you have any question, any comments, any comments related to this topic, hello, hello, hello. Okay, we are good. So this one important area of concern for me, that's talking about hypertension. If you have been a member of this community, I'm sure that you you would have noticed that at different times I've talked about hypertension, talking about achieving control, and then different discussions around it. So, as the world marks the World Hypertension Day, it's important that we talk about measuring your blood pressure accurately. We talk about gaining control and not losing it. Okay, because some people actually, at one time or the other, are able to gain control on their blood pressure, but after some time, they lose that control. So, what do you need to do to maintain the right blood pressure? What do you need to do to gain control if you are hypertensive and then to not lose that control? So let me know your thoughts about this. Are you dealing with hypertension or you know someone that is? Yeah. Let's get the conversation going. So if you have any question, kindly drop in the chat. I can see the two people here right now. So let's know where you are joining from. Let's know where you're joining. So it should be about about 8 p.m. in the United States, where we have most members of this community. So when was the last time you had a blood pressure check? When was the last time you had your blood pressure check? Your own blood pressure check. Welcome to this live. Let me know where you are joining from. Thank you for the like. Do some checks on this. So one important thing to note about this year's celebration is the fact that there's a theme, and the theme, let me drop this, and that theme actually talks about the need to measure your blood pressure accurately. Accurate measurement of your blood pressure is very important, very important. Actually begins with that, even though some people have said it's not about the numbers. However, knowing what your measurement is in the first place is what helps to categorize whether you have hypertension or not. So occasionally people have elevated blood pressure, and it could happen in relation to events, the stress factor, may even be related to diet, may be related to exercise. Okay. However, when an individual has persistently elevated blood pressure, and then there are guidelines actually for managing or making a diagnosis and then for managing hypertension. Okay. So even though we don't use a one-time reading to define a person as being hypertensive, there are certain values. For example, if an individual has as high as 180 over 120, 180 millimeters of mercury of systolic and 120 millimeters of mercury of diastolic blood pressure, then such an individual may be considered for immediate intervention, especially if they have certain symptoms that may indicate hypertensive emergency. And if they don't have those symptoms, like blurring of vision or a, a challenge with passing urine, such an individual may be classified as having hypertensive urgency. So without those possible end organ damages. Okay, so do you know someone that is dealing with hypertension, or are you dealing with hypertension? Let's get into this conversation. So we need to understand what blood pressure really is. The fact is that God has designed the human body to function, to perform various functions. And of course, the blood is a major composition of man. It's in the blood that there is life, actually. So the blood transports oxygen, transports nutrients, and these are definitely important for 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 life. I'm not sure how long an individual can actually live without oxygen or without good supply of nutrients. And imagine where there is reduction in the blood level of any individual. There's a blood loss, for example, as it happens in stroke, hemorrhagic stroke, for example, where there's blood loss, where there's bleeding occurring in the brain. So this is a very important topic, because sometimes we hear that someone out there suffered a stroke, and then sometimes some people just pass on with that kind of experience. But what can be done? Isn't it possible that such occurrences could be prevented? Actually, it's preventable. Many of the complications that develop from hypertension are preventable. And the prevention begins with taking proper measures like measuring the blood pressure regularly, and then, of course, lifestyle, dietary changes, exercising. These are very important aspects when it comes to management of hypertension and many some other chronic medical disorders, and living a healthy and fit healthy life, and then being well fitted for life. So the blood pumped from the heart, expected as expected and as God has designed it, should flow to different parts of the body through the blood vessels to different organs. All right, and um, the the what we call the blood pressure is just about the rate at which blood flows, and then the opposing effects, talking about the resistance from the blood vessels. So there's a pressure that's exerted on the walls of the vessels. So when this pressure um, overcomes the resistance from the blood vessels, there can be, of course, individual is at risk of having a bleed. The blood vessel can burst, and then there can be a bleed. So that's what happens in hemorrhagic stroke. So there's high level of pressure in the blood vessels in the brain, and so it depends on which parts of the brain that happens. That will determine what parts of the body is affected. There could also be clot formation in cases where individuals even have coexisting medical conditions, comorbidities like hypercholesterolemia, dyslipidemia, and in diabetic individuals. So this can actually uh, create room for clot formation. And we'll be looking at the risk factors for hypertension. So when there's a clot formation, at some point, that clot could be big enough to occlude an artery. And so when that happens, imagine a pipe that's supposed to carry, allow for water or whatever fluid is supposed to pass in. And then something is blocking the flow. And that keeps increasing and affecting the walls of the pipe. It can block, cause a blockage, and then preventing the flow of blood. And so when this happens, the individual has certain symptoms. The organs that are actually supposed to be supplied with the normal flow of blood begin to lose that supply. And then this can lead to loss of function. For example, the kidney function may reduce. In the brain, the part of the brain that's affected, if there's a blockage in the blood supply, can affect whether it's movement. For example, if it's the right side of the brain, the left side of the individual, the upper limb or the lower limb may be limited in movement. Individuals are some that are not even able to move at all. Okay, so we are looking at the complications that can arise. So this message drives home the fact that it's important to take preventive measures. And that's one of the reasons why I'm doing this. The need to create awareness, more awareness. According to the World Health Organization, about 1.2 billion people all over the world have hypertension. 1.2 billion people. Do you know that's a very significant number? And then um, some are actually unaware of this. You know, hypertension is said to be a silent killer. sometimes complications are setting before an individual begins to know that they have it. Sometimes it's even an incidental finding, maybe where there's a general medical checkup, out application for jobs, screening for admission into school. Okay, people get to know at different times, but it is important as an adult, especially even though the age now, there's hypertension in the young, but once you are 30, you're 40, as an adult, you should have a regular check of your blood pressure, especially if you are now having a history of previous elevation of your blood pressure, then you should have it checked more frequently. Okay, so that's very important. Let me know where you are joining from. Welcome. Kindly drop a comment in the chat. We are talking about hypertension. Okay, thank you for staying tuned. To add some extra lighting. Thank you for the votes. Thank you for the votes. I appreciate it. And thank you for the likes also. So let me know if you have any question, any comments relating to this topic. Okay. Okay, so even though there are different definitions for hypertension, different bodies with different classifications, American Cardiology Society, Hypertensive Society of Nigeria, different bodies, um, different definitions. But basically, when uh, blood pressure is greater than systolic of 130 and diastolic of 80 millimeters of mercury, then an individual may be said to have elevation in their blood pressure. Okay. Some people talk about grading from above 130 to 139 for systolic, and then from 140 and above. Okay, so we are not looking at all those details. We are looking at the fact that if, as an adult, your blood pressure is above 130 systolic and 90 millimeters of mercury diastolic, then that may be Uh, that may mean that you actually have hypertension. It's not a one-time reading, as I mentioned the other time. There has to be at least two readings uh, with some minutes apart, 2 hours apart. Very important. Thank you, Sangita. Welcome, Sangita. Thank you for joining in. Thank you for joining the live. Welcome. Thank you for, okay, thank you for the first like. Interestingly, I thought I saw two likes previously. So I don't know why it's not reflecting. Those ones are no longer reflecting. Okay, thank you. All the same. Thank you. Thank you, Sangita. Good morning. Good morning from this side. Good morning, and thank you for wishing me a nice day. You too. Do have a great day. So, we're talking about hypertension, and this is an important conversation. It's something that affects people globally, irrespective of age, sex, gender, as the case may be, irrespective of status, social status, or economic power. Okay, so but there are different risk factors for developing hypertension. Okay, don't forget that I've talked about the pressure. There's a normal pressure, should be less than 130 over 80. So when an individual has 120/80, that's good as an adult. Okay, for younger adults, maybe lower. It shouldn't be lower than 90 over 60 millimeters of mercury. And once it's lower than that, lower than 90 of systolic and 60 of diastolic blood pressure, then the individual may be said to be in hypotension, which is also dangerous. Hypotension is dangerous. Hypertension is very dangerous. Oh, okay. Thank you for showing up and showing up briefly, Sangita. Thank you. Thank you. Sangita says, okay, sir, bye. I'm attending the village marriage function in Emma. Okay, congratulations to the couple. Congratulations to your cousin. So we're still here. Let me know where you are watching from. And if you are yet to join the community, we want to welcome you. If you are watching for the first time, you can look for the subscribe button to subscribe. And of course, you can even join the membership. And the link is in the description. Okay. And we are a growing community of health enthusiasts. We welcome you. All right. So some of the risk factors for developing hypertension include the age factor. I will describe them this way. We have non-modifiable factors, risk factors, and modifiable risk factors. So I'll talk about the non-modifiable risk factors. Okay, I've mentioned age, increasing age, older age groups are likely to develop hypertension more than the younger age groups. And that's because uh, a lot of changes occur in the body, the vessels, thickening of the blood vessels that may increase resistance and the pressure that occurs in the blood vessels, blood vessels. And then other risk factors, comorbidities like increase in cholesterol, individuals who become overweight or obese may be at increased risk of developing hypertension. Another factor is race. Said that in Africa, in Asia, there is increased risk. And of course, in the Western world, the fact that there are different lifestyles that have actually increased the risk for people. So we are seeing this as a global burden, not just isolated in isolated places. Okay, so I've mentioned age, status. There's the genetic factor. Um, Talking about family, there's a positive family history of hypertension. So there's a possibility of an individual developing uh, hypertension. It may not happen in the immediate previous generation. This may be something that probably occurred in generations before. It could be two, three, even four generations before. So when there is a positive family history of hypertension, there's a tendency for an individual with such family history to develop hypertension. Okay, so those are some of the uh, non-modifiable factors. That means that there's nothing really that anyone can do, okay, apart from praying to God to not allow that flow to continue, okay, and there won't be that genetic flow, there won't be that manifestation of this condition. All right, so but there are modifiable risk factors. Okay, another risk factor is is sex. That's male or female, and depending on the age group, the particular period, there is there are differences in the numbers when it comes to whether it's found more in in the females than in the males. Okay, so but there are modifiable risk factors, and these modifiable risk factors include weight. Being overweight or being obese puts an individual at risk of developing hypertension. So, because weight can be controlled, it means that the blood pressure can also be controlled. It's a modifiable risk factor. Interestingly, there are people that actually, uh, at the initial identification of having elevated blood pressure, are able to put measures to actually uh, reduce weight, and then have been able to get some control of their blood pressure. Another factor is diet. Diet is a modifiable risk factor. It's not news that salt intake, excessive consumption of salt, puts an individual at risk. Sodium laden foods, and then low consumption of potassium puts an individual at risk of developing hypertension. So, in this age of fast foods and then diets, even in Africa, now becoming more westernized, where there are processed foods and all, this puts an individual at risk of developing hypertension. So because you can modify your diet, this makes it possible to classify uh, diet as a modifiable risk factor. Okay. So other factors, I mentioned some other factors include sedentary lifestyle. Okay, that's being inactive. I hope I'm still audible. Being inactivity puts an individual at risk, of course, of becoming overweight, becoming obese, and then this can uh, make them to develop high blood pressure. Stress is another factor. Chronic stress elevates blood pressure. But what should be happening? We're talking about making accurate measurements. So the first thing is to know how to measure your blood pressure. How do you measure your blood pressure? Okay. Now I've talked about the factors that are common for uh, people who develop high blood pressure. But in the younger age group, in younger adults, uh, where it's commonly called secondary hypertension, they are usually secondary causes. And this may include kidney disease, certain medications, people on birth pills, even pregnancy. There's something called pregnancy induced hypertension. This can also it can occur. There can be hypertension prior, and then there can be pregnancy induced hypertension, which can also lead to some complications for the mother and the baby, and may also trigger underlying genetic components of hypertension in the individual. So individual may now develop hypertension post uh, pregnancy, postpartum period. So what are the important things to note when measuring your blood pressure? I did a video on this, and you can check it out in the collection of videos that you have on the channel. You can watch it. I'll mention some of these steps that you need to take. You need to note that it's important to prepare, whether you are checking at home or you are checking in the hospital. You need to relax comfortably and rest your arm. At least you should have rested for at least 5 minutes prior to checking of your blood pressure. You should have rested for at least 5 minutes. That's very important. Okay. Avoid smoking, of course, avoid caffeine. Then you should not engage in exercise at that time. You should have rested at least 30 minutes before measurements post exercise. So, and another thing to note is that you should have the appropriate cough. Okay. I'll come up with this uh, soon. My BP monitor is somewhere around, but I'll come up with this at some time to show us what the cough is and how it should be. The appropriate cough should cover at least two-thirds of the harm in terms of the width. So it's important for you to have the appropriate cough. If you are overweight or obese, then you will need a larger cough. Because if you use a smaller cough, the tendency is to have a higher than normal reading of your blood pressure. And if you use a bigger cough than what your arm requires, then it may mean that you have a lower than the normal for your measurement. Okay, so it's important to use the appropriate cough. Then correct positioning is another thing you should note. You should sit with your feet flat, not your legs crossed, because that can create some pressure. Support your arm, place it at heart level. Your arm should be placed at heart level, and even the monitor should be placed such that it will be at that heart level and able to read appropriately. Then you should measure uh, with a reliable device. Of course, there are many devices that are now available for blood pressure measurements. So you should try to uh, be sure that you have uh, a proper, well functioning uh, device. And it's better to take two readings, at least a minute, 15 minutes, 30 minutes apart is important. Then you should record the values with date and time. Record the values with date and time. These are very important steps when it comes to uh, measuring your blood pressure. So, what are the symptoms of hypertension? As I mentioned earlier, there's a silent killer. Many times there's no symptom, there are no symptoms, but sometimes when it's becoming so high, individual may begin to have some symptoms. Okay, headache. Not all headaches uh, result from stress or malaria. Okay, on this side. Now, symptoms may include a headache actually, and headache could be persistent and even pounding, could be severe enough to disturb the individual's activity or activities. So headache is a could be a symptom. Uh, Easy fatigability, feeling tired easily, and then uh, dizziness. Some people complain of chest pain, and in some cases where complications may be setting in, because complications may affect the heart, may affect the kidneys, may affect the brain, and even the eyes. So some people may even begin to have difficulty in breathing, especially worse with activities, feeling tired easily. And then some people with little activity normally that they would not feel tired, they get tired. Climbing of stairs, staircases, they get tired easily. Walking little distances, they get tired easily. So such persons need to have a proper check. Now, other symptoms may include nose bleeding. It's actually a possible cause of uh, hypertension, could be a possible cause of nose bleeding. Then irregular heartbeat. When you hear your heart beating, that's palpitations, you can actually suspect that this could be hypertension, even though there are other causes of palpitations, okay, including a thyroid dysfunction. So those are some of the symptoms that individuals with high blood pressure could have. Okay, so if you are just joining us, welcome to this live. We are talking about hypertension, and let me know where you are joining from in the chat and what time it is in your location. So, how do you control your blood pressure? And according to the theme for this year, how do you control your blood pressure and live longer? But that's essence. Live longer to fulfill your purpose. Now, you need to adopt a heart healthy diet. We start with diet. Diet is important. You are what you eat. If you consume a lot of salt, then you have the risk of developing hypertension. So reduce your salt intake. Limit salt intake to at least uh, 1,500 to 2,300 milligrams per day. That's what is recommended. Then eat more fruits and vegetables. It's important. It cannot be overemphasized to eat balanced diet. And you need to choose low-fat dairy products, reduce saturated fats, and high levels of cholesterol consumption. Reduce that, and you'll be fine with your blood pressure. Then you also need to maintain a healthy weight. Remember, we talked about the need to uh, maintain, to have the risk of developing hypertension with being overweight or obese. So your body mass index should be in the normal range. It should be between 18.5 kilograms per meter square and 24.9 kilograms per meter square. Okay, so you need to maintain this. Regular exercise will definitely help. When you exercise, you're not just uh, moving your joints, you are also helping the heart to pump and circulate blood appropriately around your system. So 30 minutes of moderate intensity exercise uh, for at least 5 days in a week is helpful, and this can significantly drop the uh, measurements, 10 to 15 millimeters of mercury. And if you do this consistently, I'm sure you will definitely get the benefits in controlling your blood pressure. If you are not dealing with hypertension and you know someone that is, definitely they will benefit from this. You can share this link with them. Next is you should limit alcohol and stop alcohol, avoid smoking uh, as much as possible. No more than for women, a drink, two for men. Preferably, you should stop alcohol. Seek support, even if you think you have had this habit for a long time. Support will be very important for you, and you can get that. Then you need to manage stress effectively. If you are going to be having a good control on your blood pressure, you must learn to meditate, thinking on the right things, um, meditating on the Word of God, being positive, deep breathing exercises can also help, have been found to be helpful. Then getting quality, not just quantity of sleep. Of course, it's recommended that you have at least 7 to 8 hours of sleep at night. Okay, but if you do that and you still do not feel refreshed, then you have not actually gotten the right quality of sleep. So there are different. I've talked about. We've discussed this on the channel at different times. What you should be doing, the things that you can do to help you get that quality sleep, where you feel rested, waking up. Another thing to note is the need to check your blood pressure regularly. So if you have been diagnosed of hypertension, then follow your doctor's uh, recommendations, the prescriptions if you have been given medications. So you should have your regular checkups and guidance. And of course, you will benefit from support. You can share with others. There are groups, certain groups that people can have, support groups, where you can share uh, different experiences and even things that are helpful for controlling your blood pressure. People talk about some natural uh, substances, some fruits, some foods. Of course, fruits are very important. Interestingly, the hibiscus flower has been uh, tested and confirmed to be helpful in reducing blood pressure. That's talking about on this side, call it Zobo drink. It's beneficial. Okay, so you need to take your medications. If you are on medications, you should be consistent. You should adhere to what your doctor has prescribed. And if you have any challenge at any time, you should consult with your doctor for a review of your medications. And I'm sure this will help a great deal. It's important to avoid over the counter medications. There are some medications that can even worsen the blood pressure, so you should avoid them. Okay, I want to mention some of those here, but you should note that there are certain medications that can worsen or even trigger blood pressure. So those are the important areas for emphasis for this year's celebration of World Hypertension Day. Talking about making accurate measurements and then taking control and not to lose control. Not to lose control involves all these steps that I've mentioned, involves being consistent with your checkups, being regular with your PP check. And of course, there are other tests that you may benefit from. Checking your sugar levels, checking your cholesterol, checking your kidney function, doing your high checks regular yearly will also help. This will help to watch out and check for any affectation of your organs, and necessary adjustments can be made to your medications for people that may even be at risk of developing a heart attack. Okay, so for the kidney and the modification of your medications, uh, your eye check, your eye doctor will definitely help to treat appropriately, while the underlying cause also need to be treated. Okay, so thank you for joining this live. I believe someone uh, will find this live very valuable. Uh, Whether you are watching now or you watching the replay, I'm sure you will find this helpful. So just follow the steps, and of course, it's important to consult with your doctor uh, as your own personalized care will be done better as you interact with your doctor and the team in charge of your health. Thank you for watching. Thank you for your participation, Sangita. Thank you, and I wish you all the best. God bless you.